Yes, I'm Dr. Neisakho Kire, the State Program Officer for Vector-Borne Disease Control Program.
Sir, in recent days, there have been a lot of cases of dengue and malaria outbreak in Nagaland. And so, which district has the highest case reported till now?
See, malaria till now, we have not had any malaria cases except imported. We have 4 imported cases. Those are not indigenous. Whereas dengue, it is very high compared to last year. But in 2017, 2018, we had much more than this. So let's hope that it doesn't reach that level. In Dimapur, so far, we have detected 157, followed by Wokha, 16. The third position is by the Mon district, that is 8. I'm talking about this positive cases, the confirmed cases, not through RDT. RDT is supposed to be just probable dengue. We cannot call it as a confirmed case. All the RDT positive should be sent, the sample should be sent for confirmations. So the confirmation that were sent by the district, it has come up to 191.
Okay, so excluding Dimapur, Wokha, and Mon, what about the other districts?
Yes, other districts are like Kiphire, we have 1. Kohima, so far we have only 4. Then Peren, we have 3. And then even Zunheboto, we have 2. So far only 7 districts are involved. There is 4 districts we have not yet detected any.
So, sir, what are the precautions that has to be followed?
Yeah, that is a very good question. We have been telling to our public through radio, through newspaper, and even by going to the colonies, meeting the colony leaders, the household individuals, telling them to prevent themselves from getting a mosquito bite. Mosquito will transmit a lot of diseases, and at the present rate, this is dengue. Some people call it dengue, some people call it dengue. But anyway, I call it dengue. So at this transmission of dengue, people have to take care of themselves by wearing long sleeves shirt, long pant, not exposing their parts to let the mosquito come and bite. And I tell you, dengue is a day biter. So they bite mostly in the early part of the morning and late in the evening, where people mostly sit outside to enjoy the evening or the early morning sunshine. And during that period of time, this Aedes mosquito, which causes dengue fever, is most active during this period. So I would like to tell the public, even if they wanted to sit outside during this period of time, let them wear long, as I said, long sleeve shirt, long pant, covering their hands and pants. They can also use socks or some shoes. If they don't want to do that because of the hot weather, let them wear some repellent cream, where some of the creams are very good. Once they wear that, the mosquito don't come and bite. That way they can prevent themselves from getting dengue fever. This is the best method. Other than the prevention from biting of a mosquito, the other best method for control and prevention of dengue is, I like to stress on this point because, as I said earlier, we have been telling to the colony people, particularly Dimapur, since it is coming out a lot. We have been telling them, because my team used to go to their colonies, surveying the presence of mosquito larvae. We are doing every week. We keep on telling the house owners to remove those places in future. But we are still finding a lot of mosquito larvae. We do a lot of fogging. We do it by scientifically. Sometimes the public, even some authority, they ask us to do it. So because of the pressure, we sometimes do. But we do it scientifically so that it may not affect the health of our people. At the same time, while doing the fogging, some of the beneficial insects are also killed. So in order to avoid that, we are doing scientifically. And so, see, even if we do fogging, we kill the infected mosquitoes that are available today. But this Aedes causing mosquito, it spreads the viruses through its eggs. So as and when they lay eggs, the viruses are there in their eggs. And within 7 to 10 days, those eggs will hatch. And all those new offsprings of those mosquitoes will come out as infective mosquito, having all the viruses in the body. So as and when a new mosquito comes up, they will spread to other non-infected, the healthy people. So that is why I tell the public to keep removing all the materials that collects water when it rains. If they keep on removing those materials, then I'm sure mosquito will come out less. Because Aedes mosquito, they like to live with human being. They don't live in the jungles, nor they lay eggs in the nalas. Even the small containers, they lay eggs and they hatch and as soon as they come up, they are ready to infect people. So the best controlling and prevention method of dengue fever, if at all, if you want to control dengue fever, then we have to remove all the breeding places of this Aedes mosquito. We do fogging, we do larvicidal activity, we do a lot of information and education to the public, but things are not getting down. We see still our indices of mosquitoes are very high, in spite of telling the public to remove those breeding places. So if we want dengue to come down, if we want mosquitoes to come down, then we have to remove the breeding places of these mosquitoes. That is my advice.
Okay, sir, again, like for the infected people, those who are infected, is there any medicine provided by the government? And if it's there, then like how the public people can avail it?
No, see, dengue fever as such, it is a virus. So treatment is also, only the symptomatic treatment is given. So the treating physicians will treat the patient according to the signs and symptoms. So all those, we don't really need a lot of high-fi medicines. For fever, we just give them acetaminophen or paracetamol. Then to correct the dehydrations, we give them fluids, like some IV fluids. Other than that, for mild cases, that is enough. People have to stay hydrated, take rest, sleep under a mosquito if they are having fever, in order to not spread the dengue fever to his or her family members. So this is the only method, and we don't need to buy high-fi medicines or high antibiotic. We don't use antibiotic because it doesn't kill the virus. So
those medicines, it can be anywhere.
It is available in the district hospitals. Okay. So people can avail it.
And is the disease does it transmit it to other person?
See, from person to person, like flu, it doesn't spread. A mosquito, an infected mosquito has to bite another person's. Supposing we sit together, you are having dengue fever, I don't have. You cannot transmit the dengue virus or dengue fever to me. Until unless a mosquito comes and bite you, then again comes and bite me. Then only I get the dengue fever. So man-to-man transmission is not there, only through mosquito.
We did report the outbreak of dengue and malaria, this thing. So like, what is the department doing to cope up with the situation?
See, there are two main important things which we all have to do, department and the public. The first thing is control mosquito populations, particularly Aedes mosquito. We call it tiger mosquito because of its black and white stripes on its body and legs. So to control the mosquito populations, the program in the department is doing fogging to kill all the infected mosquitoes. We also do larvicidal activity where as and when any larva of mosquito is found in the water bodies, we give larvicides, some insecticide that kills the larva of that area or of that very place. Then we also send our people to survey whether larvae are present in the containers lying outside the houses. And as and when they see those larvae, they show it to the house owner. They even show to the colony leaders so that in future they may remove those larvae to the right place. Then all the larvae will die. Then we will not have much mosquito coming up. So that is what we are doing, the department is doing. For malaria, we also use larvivorous fish. The water bodies where we cannot remove all the water bodies, where big nalas, big ponds, we release larvivorous fish. Those fishes eats up the mosquito larva. So that way, mosquito causing malaria is getting less and less in everywhere in our state, particularly in Dimapur. It is found, Anopheles mosquito, the main primary vector is not found mainly in town. It is found in the peripheral area. So that is a good news for everyone. And because of which we are not having any malaria cases, even this year, till now. So for dengue, this larvivorous fish, we cannot put the fishes in a small containers. So this is the main problem that we have. So my advice is, as I said earlier, people have to, or each individual or house owner has to remove all those water containing materials outside their house. They even have to cover their syntax, their water tank. If they keep water storage like bucket, they have to cover that. Because as I said, Aedes mosquito wanted to live with human being because it gets its food easily by biting us. It also has its own breeding places readily available inside and outside our houses. So both government and the public has to play together here to control the mosquito populations. If we control the mosquito population, then I'm sure all the mosquito-borne diseases will be controlled. So if we wanted to have a less dengue fever, let us try to remove the mosquito breeding places. That is my advice.
And the department the department and government, they have been conducting several awareness campaign for the public. So like, do you think the public are still ignoring or they are practicing?
No, see, the second point, the first point I've already said, we need to control the mosquito population to have less mosquito-borne diseases, including dengue. The second point is I will like to advise the public, as I said earlier, avoid mosquito bite. As and when you sleep, go out, stay outside, sleep inside, try to prevent from getting mosquito bite. But as I said earlier, we keep on telling the colony people, showing them the mosquito larva. we call it our index, container index, house index, finally British index. All these indices, it has started rising up in the month of May. June, it keeps on rising. We keep on telling the public that the indices are coming higher and higher. Please do sanitations. Please remove the materials that are lying outside where the mosquito will lay eggs and lots of mosquito will come up. We keep on telling them, but our indices, as we study, I've been sending my staff to different colonies of Dimapur town. We have been doing fogging also. We know fogging kills all the infected mosquito, even other mosquitoes we killed. But each and every mosquito lay eggs in different places. They lay eggs in hundreds, and a mosquito, especially Aedes mosquito, it lay its eggs around 100 and 200 per sitting. So in its entire life, it lives only 21 days. But its entire life, it lays its eggs thrice. So thrice matlab it 200 per sitting. So 3 times means 600 eggs it lays. So not only one Aedes mosquito is laying its eggs. So many other mosquitoes are there, Aedes mosquitoes are there. So if we put all this together, thousands of mosquitoes are coming up the next day also. It will keep on coming up. In spite of doing fogging today, the infected mosquito or all the non-infected mosquito will be killed today. But tomorrow, so many mosquitoes, new mosquitoes are coming up. Even day after also, every day it is coming up. So fogging is not really helping us, just temporary measures. I like to inform the public to not demand too much of fogging because it also has its own side effect. So, as I said, we keep on telling awareness was all the time given during the month of July, the whole month. All the districts are observing anti-dengue month. All their activities, they were informing and educating our people to remove the breeding places of Aedes mosquito. But as I said, in Dimapur colonies, we are still finding a lot of mosquito larvae in the compounds. I said container index. Whenever we find any container having mosquito larva, we call it a container index. There's a lot of still larvae lying in those containers. So I don't know why our public are not afraid of having a mosquito-borne diseases like dengue. People are afraid, I believe. So they ask us to do fogging. But fogging is not the end. Many new mosquitoes will come up tomorrow. So better not rear them and asking us to kill it. I believe it is not, if I may say, you rear and asking us to kill it. I believe that is not very fair also. So let us all cooperate with each other and then remove all the breeding places of mosquito. Mosquito will come out less. We will have less mosquito-borne diseases. And that is the only way where we can control the dengue and other mosquito-borne diseases.
Okay, so like for this fogging thing, for how long does it work?
No, see, when we do fogging, we ask the house owners to open up their windows and doors where the fog can come inside and then kill the mosquito that are available inside the house. But at times we see that since the fog is smelly, people tend to close their doors and windows. So that is just the opposite that we wanted them to do. It doesn't last long. Once the smoke goes away, then the effect goes. But once the fog comes and in touch with the mosquito that are available there, it will kill it. The fogging is very effective in killing mosquitoes. But fogging doesn't kill the eggs. Fogging doesn't kill the larva. So this is the problem.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.